So students who come to you, they might be worried about sort of it getting escalated to other members of staff. So can you sort of explain the confidentiality?
We try in almost every instance to maintain confidentiality. We have to. We can't even share information with their parents. And so what we tend to do is identify what the issues are, and they can be multitude. They could come from emotional health problems, in which case we ask the student themselves to seek support from their GPs. We'll ask who else they've sought support from. And often students with emotional health support want to continue on the course, but at the same time need to be aware that they want that support, but they've got to decide who could share that information. And we often need their permission to tell other tutors who are on that particular module that they require additional support. That's the tough bit, because often a student who feels really low and doesn't want anyone else to know, yet wants to continue as if nothing's happened, will struggle even more. And what we encourage them to do is to allow us to share that confidence with other selected members of staff. The members of staff want to support them. They're not here to be prejudicial. And the more people they'll ask to share the information with, the better. Second category are those where they come along with other issues, personal issues, where we definitely keep things confidential. And so these are issues involving their family, their relationships, boyfriends, sometimes even concerns that they might share about themselves. And unless we think it impinges upon patient safety, we tend to maintain confidentiality. We keep a record ourselves because we know that there are 4 subdeans. And if they're going to see one person, we'd like to imagine that if that person was not there, that same information be available to the next subdean. And so we tend to work quite closely as a group of subdeans, but maintain confidentiality within that group. Last group were those where we think they might pose a danger to patients. So if we think there are alcohol, drug-related problems, then certainly here we have to be much more careful. What we do is we discuss the issue with the students, and the students always ask us how far we maintain confidentiality. And what we try to do is base it on a student-by-student basis. We tell them we've got to be open, we've got to share some of these concerns if we think what they've disclosed is dangerous to patient care. But at the same time, these are students themselves who want to control their habit or their problem, and that's why they're sharing it with us. What we don't want to do is to scare them off and stop them talking.